Yes, with tile on the floor and a slanted ceiling.
Yeah, try not to look at that window behind me. It's not finished yet. All right, Allison, are we live?
We are.
Awesome. There's that little button on my screen. All right, we will then call the Public Health and Human Services Board meeting for August 18th to order at 8:30 a.m. We are joining the world via Zoom. And I will start out by explaining why we are meeting via Zoom. For those of you who have missed out, there seems to be a COVID-19 pandemic in the world, and I'm sorry if y'all missed it. Newsflash. So we are meeting via Zoom, and we can do this because it has been determined that an in-person meeting is not practical or prudent because of the COVID-19 pandemic and the related peacetime emergency declaration made by Governor Walz in coordination with Minnesota Statute Chapter 12. The statute is 13D.021 subdivision 1. 2, we have ensured that all members of the body participating in the meeting, wherever their physical location, can hear one another and can hear all discussion and testimony offered today's meeting. Same statute. Number 3, we have also ensured that members of the public present at the regular meeting location of the body can hear all discussion and testimony and all votes of the members of the body. We have urged the public not to attend this meeting in person because of the COVID-19 pandemic and have ensured that members of the public can view and monitor the meeting remotely in real time by broadcasting the meeting on the Cook County website. 4, due to the COVID-19 pandemic, we have determined that it may be unfeasible for County Auditor Brady Powers, County Attorney Molly Hicken, County Administrator Rena Rogers, and members of the board to be physically present at the public health meeting in the Cook County Courthouse. All votes will be conducted by roll call, so each member's vote on each issue will be identified and recorded. And that is it for the fun, difficult updates and legal things that we must do before we get started. So the first thing we have is approval of the consent agenda. Would anyone like to pull anything from the agenda? No one is jumping up and down. Okay, can I get a motion to approve?
I move to approve the consent agenda.
I'll second.
Roger, you a second? Awesome, and we will do roll call. Commissioner DeShaw?
Aye.
Roger?
Aye.
Andrea?
Aye.
Myron?
Aye.
Ginny?
Aye.
And I am also an aye, so that is all. We pass unanimously.
Aye.
And that, oh, Dave, sorry I missed you. I knew I was missing one in there. I'm like, why do I not have enough? Sorry, Dave, you're not on my screen. So I'm, you know.
That's fine.
Out of sight, out of mind.
There you go.
All right, we will move on to staff report, and just a little update for those that missed from Allison. We have some new staff coming in. So Lori might talk really fast because staff have other obligations and they need to pop in and out. So it'll be kind of interesting, but we'll let her roll. Take it, Lori.
Good morning. I'm going to
Morning.
share my screen here with everybody. And all right. A couple of disclaimers before I start the budget presentation. The CCEA and the county have not completed their contract negotiations yet. Therefore, this budget that I'm presenting does not include any potential COLA increase for 2021. That's excluded because we don't have one currently settled in any type of negotiations. Also, I understand next week there will be a budget presentation to the full county board from Brady regarding the entire countywide budget. And he is giving a baseline budget that only includes 2020 wages and not any 2021 step increases. I chose to present this budget today with the 2021 step increases, just to give you a full idea of what it costs for our department. Also, because we've got so many staff in here that not including those step increases in the budget doesn't give you a full idea of the full impact of what those step increases would be if we were to exclude them. The differences between just showing you a base budget with 2020 wages and showing you the 2021 step increases that are already something that HR has approved that people would receive in 2021 is significant. In our department, it would be over $62,000 difference. So that's why I'm showing you with the 2021 step increases. So here we go. There we go. Our mission statement was crafted back in 2014 by our staff. Cook County Public Health and Human Services is an integrated agency. We do have 3 complete departments: income maintenance, public health, and social services. Together, we are responsible for the administration of many state and federal programs which provide support for those in need and promote and protect the health and safety of our residents. The budget that we are proposing for 2021 reflects a slight increase over the 2020 budget, 1.45%. However, the county contribution that is being requested to support these 3 departments is actually a decrease from 2020 by 1.75%. Our budget is a result of a thorough line-by-line exam of all the administrative and programming costs and revenue opportunities with each department and with all the supervisors in these departments. So I'm going to go into each of these individually, and then let me know if you have any questions. I'm hoping it makes sense. The expenses in the 21 budget are allocated across 3 departments as follows. 65% of the budgeted expenses are allocated to social services with 2 main areas: adult and home and community-based services and children and family services. And for those in the viewing area that aren't familiar with everything that we do here, I'm just going to give you a brief rundown. Adult and community-based services, this includes adult protection, min-choices assessments, information and referral, adult services case management, care coordinations for individuals on managed care plans, in-home support program, which provides independent contractors the ability to provide homemaking, transportation, companionship, respite, and chore services to community members, intellectual and developmental disability case management, waiver case management, guardianship, and conservatorship. Also included in social services is the children and family services. This would be adoption services, child protection, child welfare case management, children's mental health case management, child care and foster care licensing, information and referral, parent support outreach program, adult mental health case management, civil commitment, chemical dependency case management, also chemical dependency services with a contract through Wilderness Outpatient Treatment Program that provides chemical dependency evaluations and outpatient treatment visits. Aftercare, relapse services, also information referral for those, and assistance with funding for the chemical dependency services. 22% of our budget is allocated to income maintenance. Income maintenance provides the administration or support for several state and federal programs, such as financial assistance, cash assistance programs like diversionary work program, general assistance, the Minnesota Family Investment Program, Minnesota Supplemental Aid and Refugee Cash Assistance, Child Care Assistance Program, Funeral Assistance to Indigent Clients, that's the county burial funds, emergency assistance funding to prevent homelessness or utility shutoff, employment services that we contract with AEOA, Minnesota healthcare programs, medical assistance, Medicare savings programs, medical assistance for long-term care services, also healthcare assistance, application assistance, supplemental nutrition assistance program, the child support services that we contract through Carleton County provides paternity establishment and enforcement of child support court orders. 13% of the budget is allocated to the area of public health, which has been very busy lately. This would include disease prevention and control, emergency preparedness, preparing and implementing shelter and evacuation, mass feeding and disease response, community health promotion, partnership with schools and providers to create initiatives to keep children safe and healthy, community health assessment. We also have contracted services with Sawtooth Mountain Clinic for foot care, blood pressure, and blood sugar screening, the Safe Routes to School program, active living initiatives, women, infant, and children nutrition program, community education, prenatal, postpartum, newborn, and child home visits, the follow along program, and child and teen checkup, which well child checkup promotion for children and teens on medical assistance from birth all the way to 21 years old. The area of the 13% allocated to public health also includes the public health fund. Under state statute, counties have authorization to contract with separate agencies to provide services within the county that serve a public purpose. In 2018, the county board moved this responsibility over to PHHS for requesting proposals, reviewing applications, and making recommendations for funding grants to those organizations that serve a public health purpose. So our agency as a whole will see a planned increase in salaries. This is due to annual step increases that are due in 21, and an anticipated insurance, health insurance increase and other operational costs. Under the area of income maintenance, we are projecting an increase of 2 3/8% of expenses, but an offsetting increase in revenue of 4.25%. Social services projects that expenses are going to be about 2.5% higher than 2020 budget. But we also have an 11% planned increase in revenue in social services. We've improved our procedures in documenting and reporting our staff programming with DHS. This results in increased state and federal funding. We've also increased our efforts to obtain more reimbursements for case management services, chemical dependency assessments, and outpatient treatment fees from third-party agencies. This would be folks that have third-party health insurance. We can seek reimbursement from those folks. In the area of public health, they have a 5% decrease in expenditures and a 24% decrease in revenue. This is due in large part to a huge grant that we received in 2020 to fund the startup of the evidence-based home visiting program through the clinic. That grant award is greatly reduced in subsequent years, so that's why there is a huge reduction in revenue and also a reduction in the expenses. The public health fund under the area of public health will have a 1% increase. In 2020, $130,505 was awarded to applicants to serve a public health need in the community. The increase for 2021 is less than $1,500 for a total of $135,000. At 58% of the budget, personnel is the largest expense for our aid. We are people serving people. 34% of the budget goes to direct program costs. This would be the out-of-home placements for children, mental health placements for both adult and children. The public health fund is also in that area. That also includes the purchased and contracted programs and services such as the child support through Carleton County, the contracted CD treatment program, and public health programs like WIC and SHIP, and public health outreach services that are all contracted through the Sawtooth Mountain Clinic. Services and charges make up 8% of the budgeted cost. This would be our software licenses, staff training and travel, which is greatly reduced for 2021, and the administrative costs, such as the IT costs that we pay to the county, the Human Services Board and Advisory Committee per diems, fees that we pay to the state auditor, and rent that we pay to the general fund. Budgeting for unknowns is always a challenge, and out-of-home placements is the biggest unknown expense. I work very closely with Children and Family Services Supervisor to come up with the best estimate for the future out-of-home placements. This would be including shelter services, family foster care, treatment foster care, residential group homes, correctional placements in detention, and mental health placements. The cost of placements in facilities can average more than $350 a day, and this rises annually. In 2014, if you look at the graph, we had 10 out-of-home placements for children. But in 2017 and 18, we had 26 placements each year. This is where I'm saying this is hard to come up with a good estimate. In 2019, we budgeted for 19 placements and had only 7. We budgeted for 13 placements in 20 and 21.
Lori,
State, yes.
do we have a year-to-date for 2020 with out of home?
For the number of clients that we have in placement I think I do not have that number readily available. I'd have to check with Grace Bouchard first before I quote that number. The revenue sources that we have, state and federal reimbursements equal more than 1/3 of our anticipated revenue. Fees for service and miscellaneous are projected at 9% of our department revenue. These are typically payments and reimbursements from the private health insurance for the CD services or for the senior health options. This also includes the state recoveries and non-governmental grants. At 56%, county levy is the largest source of the funding for our 3 departments. In 2019, property taxes made up 60% of our agency revenue. We are constantly searching for more grant opportunities and improving our third-party collections, which is why now that the property taxes would make up 56% of our revenue as opposed to 60%. Here is our org chart. This reflects the many services that are provided from all 3 departments and through several purchase of service agreements with outside agencies. That's why we include the contracted services providers as part of our organization chart. Without these contracted partnerships, we would either need more staff or these services simply would not be available to the community. Besides our human service board that is over us, the county administration has another layer of this chart, and that is that the majority of the programs that are administered by our agency have state and federal oversight as well. We are not proposing any new positions for 2021, but we intend to finalize the staffing for the SUD treatment coordinator. This position has been temporarily filled with 1 staff person that's been performing dual roles, working in an out-of-class position with another, in an out-of-class assignment with another position. Historically, our fund balance has shown a shortfall from the amount that's recommended by the Office of the State Auditor. This graph shows the fund balance since 2011. The red line represents the amount that we should have had in our fund balance if we had an adequate balance to meet our budgeted expenses. The gap between the red line and the blue bars shows the shortfall in several years. In 2018 and 19, our expenses that are shown on the red line were lower than projected, and the result was returned to the fund balance in those years. So state and federal funding is allocated on several different fiscal schedules, and since local governments rely significantly on property taxes, the Office of the State Auditor recommends that we maintain an unrestricted fund balance of no less than 5 months operating expenditures. This amount should provide for adequate funds until the first half of property taxes are collected in May. So 5 out of the 12 months equals 42%. The planned expenses that we have in our budget for 2021 are $4,505,000. For us to meet the financial obligations of our agency for the first 5 months of the year until property taxes come in and federal funding comes in, we should have at least $1,892,000 in reserves of our fund balance. Our 2019 unaudited fund balance for PHHS is $2,360,000. This balance will permit us to meet our financial obligations going into 2021 before the first half of property taxes are collected and distributed to the different departments. And it also allows us the ability to cover any unbudgeted expenses that should arise. Unknowns and things looking ahead. Generally, the state and federal reimbursement rates are not increasing at the same pace that the different counties need. Other than salaries, out-of-home placements can be a very large expense. We budget that based on known placements at the time, historical trends. Mental health placements is another area where significant expenses have to be estimated. The mental health residential placements for adult and children can range anywhere from $300 to $1,300 a day, depending on the level of care in the state facility. Just one unbudgeted placement in any of these areas could completely deplete an inadequate fund balance. Yet another reason to have a healthy balance. There are costs associated with staff turnover, and our agency is not immune to resignations and retirements. There are expenses with payout of leave balances and recruiting and training and onboarding new staff. There's an impact on other staff during transitions. There's also an impact on people that we serve when staff turnover. Staff, when they resign, there's a loss of institutional knowledge if an experienced staff person leaves. So that's a big impact. There are a lot of changes in Minnesota Department of Human Services and at the federal level. We know of several funding sources that run on a fiscal year that ends on June 30th. Administration changes can affect our ability to continue providing programs without relying on local funds. And staffing, when we are fully staffed, we have the capacity to seek out additional revenue sources. We've got our supervisors have spent a lot of time in this last year seeking out new grant opportunities and finding other ways that we can bring in revenue to bring in more programming for our agency without relying on county funds. So being full staffed is allowing us to be able to do that. So here's a final look at our budget request. Again, this does include the 2021 step increases. Does anyone have any questions for Allison or myself? And I'll leave this here for the viewing public to have our numbers.
If anyone has any questions, just go ahead.
No questions, just a comment. Lori, that's a wonderful review, and thank you for putting all that together. It's sounds encouraging, and we hope that things will, you know, be maintained. Of course, they will be maintained by the office, but it's a big job, and I appreciate everything that everybody does, especially the encouraging thing about being full staff. Then you're able to look into more funds and grants and so forth. So kudos for everyone, and especially to you, Lori, for putting this together. It's great.
Thank you.
Lori, have we seen any impacts of the COVID virus on out-of-home placement or mental health placements yet?
Not in the areas of out-of-home placement. Allison, would you like to speak to any of the impacts towards mental health?
I know anecdotally from our staff that they're experiencing an increase in mental health calls. I don't know that that necessarily correlates to an increase in placements. What I hear from my colleagues in the region, not necessarily from staff internally, is the concern with out-of-home placements is that this is likely the calm before the storm in terms of seeing some of the long-term effects on the stress that families are experiencing. Also, summer is generally a quieter time for reports as kids aren't in school. So again, really trying to be prepared as possible for the unknowns. We're so small that one or two unexpected placements, either in out-of-home placement or mental health, can really make a big difference on our department budget.
Yeah, and we're going to have a tough time gauging that going forward with distance learning, because I think that the teachers are the eyes on the ground when they know something is arising with a student. And so it's going to be interesting, I guess. Thank goodness you have the staff that are there that are reaching out and putting information out so that people continue to know that we're a resource for them if they're struggling at all. And so we'll just see what happens going forward, but it's good to see that fund balance finally where it needs to be so we can handle it if it comes up.
Madam
Does
Chair.
anyone else have questions? Go ahead, Dave.
Thank you. Yeah, sticking on the out-of-home placement topic, and maybe it's not fair to generalize. Are you saying that fall is generally when we see, and is it how do I say it? When it comes to out-of-home placements, do we already have staff that are working with the families that receive out-of-home placement services? Or is it largely just coming from the reporting of the mandatory reporting agencies, or how can we best gauge this going forward? Does any of that make sense?
I think I understand what you're asking, and I'll take my best shot at answering it. There are different circumstances in which a child would need out-of-home placement services. For example, residential treatment for mental health. So in that case, a child or a family might already be receiving services from our agency through children's mental health case management. Why we've seen such a decrease in out-of-home placement costs over the last several years can be attributed to the work that we're providing with families to prevent out-of-home placement. So more voluntary case management services, the parent support outreach program. So in many cases, we're already providing services to a family working to prevent out-of-home placement. Of course, there are always unknowns. Things can happen with families that are already living in the community or relocating here, and that's why it's very important for us to have that adequate fund balance to be able to weather some of those unanticipated expenses. We do always budget for some unknowns. We know to expect the unexpected. But the work that Lori and Grace Bouchard are doing is a result of very careful planning, looking at what we know and can anticipate, and also budgeting for some anticipated expenses as well. Did that answer your question?
Yeah, I think so. And just as a follow-up, thank you. And just as a follow-up, so how during social distancing and this time, how has that been working for staff that are working with families to try to prevent out-of-home placement?
Allison, before you answer that, do you want to do the quick introductions? We got one that needs to leave.
Yeah, yeah, please.
Sorry, Dave. I didn't want to interrupt you before you asked the question because you might lose it.
Definitely.
Looks like Maggie dropped off
Okay.
the call. I'll answer Dave's question really quick and then pivot to the staff intros if it works for you.
Yep.
So what I'm hearing from staff is that it's difficult to connect with families and individuals during this time of social distancing. It's very hard to provide the level of service that they're accustomed to. As Lori said, we're people serving people. That personal connection and eyes on is really important to the work that our social workers do. They have been really creative in finding ways around that over the last several months. They're seeing a lot of people out of doors, meeting with people at their home, but outside, or at the courthouse outdoors. We've made some modifications within the office to be able to meet with people more safely. We've used some of our CARES funding to purchase personal protective equipment for our staff who need to go out into the field. But it's a very difficult and delicate balance to provide the level of service that they're accustomed to while following all of the recommendations of public health best practices.
Yeah, so the calm before the storm is likely. Yeah.
That we're very concerned about how we will manage going into the winter.
Any other questions for Lori? Bobby, do you have a question? You're leaning in.
I'd just like to thank her for the presentation. She's always did a real great job, clear, to the point, and easy to follow. So thanks, Lori. Keep up the great work.
Thanks, Bobby. Appreciate it.
I think that was Bobby's way of saying farewell. He's leaving us after today. Any other questions? Okay. Looks like Allison, you're up.
I'm actually going to throw it to Grace to give introductions to each of our new public health staff who are joining us this morning.
All right.
Hi, and good morning, everyone. I'll turn my video on. So we have 4 temporary public health staff, and one of them is going to be jumping on late. One had to leave early, and I know Sadie Sigford is also leaving early, but I'll do a quick introduction here, and then if folks have questions, there'll be time for that. So I'll introduce Sadie first because I know she has to go. She's going to be joining us as a perinatal COVID-19 health educator and getting virtual peer support groups for people who are pregnant and up to a year postpartum off the ground. And the idea is to decrease social isolation and stress that people who are pregnant or are newly parenting are facing, because they are essentially being told to stay home and to stay away from what traditionally might have been their support networks, extended family or friends, because of the pandemic. So the idea behind Sadie's position is to provide additional support in this crucial period of human development. Sadie has a background in maternal child health and midwifery and is also a resident of Cook County. So we're very excited to have her joining us temporarily. This is a position that is funded with the CARES Act. All of these positions are the CARES Act grants to help us in our pandemic response. So Sadie, do you want to introduce yourself quick? I know you have to head out here.
Sure. Thanks for the introduction, Grace. It's nice to meet all of you. I know a handful of you, but kind of nice to get to see everybody's face. I have worked in maternal child health and midwifery for about 9 years. I'm really excited to be able to kind of get this support project off the ground. I think it's something that a lot of us heard was a need before COVID, and of course is exacerbated now. Yeah, I don't know if there's particular things that people want to know.
I'll also add in, this is very complementary to the work that we have with the clinic, with the maternal child health programs that we contract to Sawtooth Mountain Clinic. So having this space for peer support will also allow us to have an additional avenue for referrals to clinical services with Hannah Miller's role in home visiting and the WIC program. So it looks like we have, frozen, so I hope you can all still hear me. I can no longer see anyone's face moving. Does anyone want to just chime in so I know that people are still able to hear me?
Yep,
We can
still
hear you.
here.
We can
Yeah,
hear
yeah.
you.
Sounds good. So we also have 2 staff people who are training in on case investigation, contact tracing, and also doing some additional support projects with public health, including the technical assistance for businesses and providing some support materials to the schools. So the 2 people who are providing those services, one is Maggie Farshman, who had to leave the call early. And the other is Andrea Tofty, who is able to be here with us. And they are midway through the training for case investigation, contact tracing. And I know Kristen's not on the call, but I also want to recognize the fantastic work that she's done in putting together a training right after she herself trained in and started to take on this work. So she's been doing a great job at building our capacity in this area. In case we get a surge of cases, we'll be ready for it. And we'll be ready to have Andrea and Maggie step in and help with those calls in that process. So Andrea, do you want to introduce yourself?
Hi, so So yeah, like Grace said, I've been trained to perform as a contact tracer, and I'm also helping with technical support and to yeah, find educational materials or in support of businesses and to aid the COVID-19 response.
And so we're extremely fortunate, thank you, Andrea, to have both Andrea and Maggie joining us as well. They both have, Andrea has a background in environmental sciences and Maggie has a background in pharmacy. So they both come with quite a bit of understanding and experience that's very relevant to understanding risk as it relates to COVID and communicating that to people in phone interviews. So welcome, Andrea, and thank you for being here this morning. And then finally, we have Jody Turvo-Roberts, who is acting as our school liaison. Jody has also trained in on the basics of case investigation and contact tracing, but at least initially, her role is more acting as that link and that liaison between public health and the schools. So if some of our area schools are having in-person learning this fall and someone were to get sick, she would be the person to facilitate the communication between the case investigation contact tracing team and the staff at the school so that we're able to provide support to the school staff and the school families in knowing how to connect, how to support them in connecting with testing, isolation, quarantine, and just making sure everyone knows what to expect. So a big part of Jody's work right now is providing some uniform public health education materials that will be for families across all the schools. So things like what is COVID-19, how to prevent it, what to expect when someone is sick, how to connect with testing, what to expect when you're waiting for a test, what to expect if you have to isolate or quarantine. All of those things we're trying to get it out there widely and so that everyone's on the same page, everyone knows who to talk to. There aren't any kind of variations in messaging. Another thing Jody and I have been doing, and we set up the first call last week, is having a weekly briefing with representatives from all schools in the area that include Cook County Public Health and Human Services, as well as Grand Portage Health Services, so that all school leadership know what the basic kind of situational awareness is, different data points that they can use to help them as they decide what's best for their school and their families throughout the year. So that's a weekly briefing call, and Jody and I are setting that up together. We had our first call last week. So that looks at that MDH 14-day case rate, but it also brings in kind of local context, what we're seeing with our local EMS, our local clinic hospital, our regional hospital, what testing is looking like, all of those variables that are useful to schools as they decide what to do. So we're very fortunate to have Jody. She has a background in both public health and as an educator working with ISD 166 in the early childhood special ed department. So Jody, I know that you just joined us, but do you want to introduce yourself briefly to the board this morning? I think you're muted, Jody.
Sorry, I was. Hi, I'm Jody, and I'm typically working in the afternoons and taking care of our little baby in the mornings and swapping with my husband. So it's been a great experience so far, and I really look forward to helping with safe planning for all of the schools, especially now that there's a variety of options for the schools and the choices that they've made.
Jody. So like I said, all of these positions are temporary part-time positions being funded through CARES Act dollars. And I'm thrilled to have found a wonderful team of people who've been really willing to step in and support our public health response on very short notice. They bring a lot of skills and experience that are directly relevant to our work. And it's just been a huge gift to have them all join our team and our response efforts to add capacity to things going forward, looking to the school year and looking to the fall and winter months. So thank you to all of the staff who were able to be here this morning, and thank you also to the board for being supportive of expanding our response activities alongside the pandemic. I'm happy to take questions as well.
Go ahead, Dave.
Thank you, Madam Chair. And I don't have any questions, Grace, and I just wanted to thank you and thank the staff, Jody and Sadie and Andrea and Maggie, who's not here. But I just feel very, very fortunate that we have these skills and experience in our community and that we're able to use the CARES money to provide these services for our community. It's just going to make everyone safer and stronger and healthier. So I feel, I know it's not just luck, it's you know, good outreach and planning, and I just am very appreciative of all that. So thank you all.
Thanks, Dave.
All right. If there are no other questions, we will let them all get back to their very busy schedules helping out our community. Thank you, Grace.
Thank you all.
All right, Andrea, goes to, or I mean, Allison, it goes to you.
Want to echo the kudos to Grace and Kristen for their work in onboarding and training each of these temporary employees. We're very fortunate to have their support and to have Grace and Kristen providing them with their onboarding and orientation. Also want to give an additional kudos to Lori for her work on the draft budget that was presented earlier. It reflects many, many hours of hard work, careful planning with each of the individual unit supervisors to come up with our best assumptions for expenses and revenues for next year, knowing that there will be many unknowns, including at the state and federal level. An update on CARES funding. In addition to each of the 4 temporary public health staff that you met this morning, we are still in the open grant period for the public health grants for 2021, as well as the CARES assistance funds to nonprofits and service agencies. So those are the grants to support programming for nonprofit agencies and childcare providers. Additionally, we have a policy in place now to issue assistance to individuals and families using CARES dollars. So these would be for people who are experiencing a household crisis, for example, facing homelessness or eviction, utility shutoff, in need of funeral, payment of funeral expenses, or other basic needs that are directly related to the COVID-19 pandemic. I did put information on how to apply for these CARES funds on a information sheet that went out last week from the Emergency Operations Center on Financial Assistance Programs or Economic Assistance Programs. That document is also available on the Cook County COVID Hub on the top banner under Economic Assistance. I am also planning on sending that out to our advisory council membership, as well as other agency partners within Cook County, so that they can assist in getting the word out about the availability of funds that we administer in PHHS, as well as these newly available emergency funds through CARES. As a follow-up to our July meeting, Commissioner DeShaw asked about the current unemployment rate in Cook County. I did send an email out to the membership after our meeting, but just wanted for the record to share those numbers here in our meeting. Sorry for all of the email notifications. So Cook County's current unemployment rate as of June 2020 is 10.6%. This is up from 3.5% in June of 2019, but is down from the all-time high in April of this year, which was 15.3%. And that information is available by county and by region on the DEED website. Lastly, wanted to give an update on the most recent special legislative session. Last week, the House and Senate passed Senate File 1, which includes county priority to extend human services waivers for economic assistance programs. This waiver will allow our staff and staff throughout the state to continue to allow remote interviews for economic assistance programs. And this is extended through June 30th of 2021. This waiver extension also includes a dozen other human services waivers, including allowing electronic signatures and telehealth services. That's all I have for updates this morning, but I'm happy to take questions.
Anyone have questions for Allison? That means you gave an excellent report and it was very clear.
Thank you, Commissioner.
Next, we have items for board action. Allison, you want to take those?
So under items for board action, we have a contract addendum. So this would fall under our master contract with the Sawtooth Mountain Clinic for a number of other public health services. But this is specific to COVID-19 patient public health education. This is funded using our CARES dollars through November. And I believe that the clinic has hired someone into this position, and it will be a really key part of our response in partnership between public health and the clinic in providing information on isolation and quarantine, testing, and general public health outreach specific to our COVID-19 response.
And the addendum is in your packet, so we'll start. Does anyone would like to make a motion?
I'll move to add the contract addendum for the COVID-19 public health education.
Thank you. We have a motion by Dave. Can I get a second?
I'll support.
Thank you, Myron. Does anyone have any questions for Allison on the addendum before we take a roll call? All right. So we will do roll call. Myron?
Aye.
Dave?
Aye.
Ginny?
Aye.
Andrea?
Have to abstain from a Sawtooth Mountain
Oh.
Clinic employee.
Yes, good job. Roger?
Aye.
Bobby?
Aye.
And I am an aye, so we have all ayes and one abstaining as an employee of Sawtooth, so it passes. Thank you, Allison. And next we will move on to committee reports, and we start with Commissioner Mills.
AOA meets tomorrow, so I have nothing to report on that for the moment.
Okay. Arrowhead Health Alliance?
We did meet, and a lot of the discussion was about the state of telepresence. I guess I should back up a little bit. Previously, I had talked about a lot of concern about uncompensated care at the Birch Tree Center or just in the region. And whereas we're not through all this yet, it seems like that is less of a concern at this point. So that was encouraging. The numbers are fluctuating as far as the admittance, and but it's not as alarming as the previous meeting where I reported an increase in uncompensated care and just not an increase in funding or compensation. But back to a large part of the discussion was about telepresence and how the state's video system, VIDYO, is what was used, and how before the pandemic, I think the usage was like 5,000, and then overnight it jumped to 15,000, and how everything crashed, it just doesn't work, it's not supported. And so there hasn't been a real great champion at the state level to fix this. But in our region, they're trying to coordinate with Region 9 to create a system. And that includes 17 counties in total. And so the strategy seems to be to develop and really get a solid system going for these 17 counties. And then with that, costs are reduced significantly if more counties or more regions join. And so there's that thought, but then also if you know, the leadership is done at the local or regional level, then maybe the state will jump onto that as well. So it's pretty discouraging to not have that state level push, but it's extremely encouraging to have strong leaders in our region and to really try to work with it and improve it and solve the problem. So at this point, there isn't an actual recommendation, but Rick Schaefer at AHA is going through different platforms and trying different things. And then Dave Lee from Carlton County is on the big push with the telepresence platform. So I think that's the long and short of it.
Thank you, Commissioner Mills. Next, we have Arrowhead Regional Corrections, Commissioner DeShaw.
We meet on Friday. Be my last meeting. So.
All right, Ginny, Arrowhead Regional Development Council.
We did not meet.
Commissioner Mills, Community Health Board.
We met there as well, and previously I reported about kind of the makeup of funding not rolling things over, and I have to apologize, my connection was unstable, and so I missed a large chunk of that conversation. So maybe Allison can help fill in the board here, but again, there's nothing firm set, but our director Susan Michaels is laying out some options to consider. And Allison, please correct me if I got it mixed up because of my technology issues there, but it sounds like there's options to pay a little bit now, or just to lessen, not tearing off the Band-Aid and just doing a little bit more planning as options. And I'm not really clear how much it'll affect Cook County. St. Louis County is by far has the biggest impact on, because they're the biggest player in the community health board. But it will affect us, and you know, it's all relative to each county's budget. So it's certainly something to pay attention to. The other things that I was able to fully listen in on were two reports. One was about paternity leave, and as well as maternity leave, coming from our medical representative, Dr. Tim Kupal from St. Luke's, and then and the real impact that both paternity leave and maternity leave have on a culture and a country. It's really staggering. The United States is at the bottom of the list for medical leave and paternity and maternity leave. And what they found is just it's incredible, the reduction of adverse childhood experiences, when leave is used to its full extent and when babies and children have the support they need from either parent and both parents, and how just happiness and the health and thereby healthcare costs are all affected. It's a lot of food for thought, and I'll try to share the presentation with the board here, but it really gets a person thinking that we should be doing a lot more and trying to push for this. But of course, it's systemic. It's a national issue. I don't know how much we can do at the local level or even at the state level, but it is quite eye-opening. And then the other presentation that was given that was very informative and I was somewhat familiar with and educated on, but it's just the impact that breastfeeding has on the health of a child and thereby the health of the community, and thereby the reduction of costs to a community. Again, those numbers are just incredible, and I think as a state, we do very well in our numbers of breastfeeding mothers. And then also our region is like #1 in the state on that level too. And so I know we have a good support network here in Cook County, and it's all about educating young and new mothers. So we're doing a great job, but the more we can leverage that education, the healthier we'll all be, and the more successful we'll all be. And if you want to look at it from a dollars and cents point of view, the less money we'll be spending on healthcare. So it's just really interesting food for thought. So I'll try to get that presentation to the board as well.
Thank you, Commissioner Mills. I know since I've been in office, the Public Health and Human Services has really done a lot to impact that very first months of life, because we know the impact. So the support of past people in public health and past commissioners and really moving forward. I mean, when we looked at Lori's budget and looked at where we were on the fund balance, it was pretty grim when I started. And so I leave with a lot of hope. So thank you, Allison, for your continued work on that in your department and the history on that. And you, Andrea, at Sawtooth, you have your fingers in a lot of that stuff too. And so it's really, really important. Moving on to Public Health and Human Services, Roger.
We have not met, but we are meeting on September 1st. And I just want to take a second to thank Commissioner Desha for all of his work, not only for all of the county, but especially for his constituents in District 1. Thanks. And all the best in your new leadership position.
Thanks, Roger.
All right, next up is Andrea with our Cook County Local Advisory Council for Children's and Adults Mental Health.
Yeah, so we met on August 11th. We were joined by our newest member, Brittany Anderson from Grand Portage Human Services. Carly from Higher Ed said that they were seeing an influx of help requests for the upcoming school year. And they also anticipated an increase in mentorship requests because of the distance learning and pandemic situation. Carly also shared that the Mindfulness Monday program on WTIP is going really well. In her and my opinion, we haven't actually received any formal feedback from the community or WTIP, but I think it's great, so that's going great. Let's see, Allison gave an update on the temporary public health staff additions. We also talked about 3 what I'm still going to call public service announcements, even though that might be the incorrect name, that the advisory council agreed upon to have shared on WTIP, sharing information about the council itself, and then just positive messaging for the community that they are supported and loved, and the community is here for people who need help. Let's see. And James from Sawtooth Mountain Clinic said that they're sort of piloting a behavioral health after-hour appointment on Tuesdays from 5 to 7. They have behavioral health staff available right now to see if available for appointments to see if that's a time that will benefit the community. So that's a positive change. And I think that's it.
Thanks, Andrea. Next, we have healthcare planning, Commissioner Storley.
Thank you. Yes, we always meet on the first Friday of the month, and generally I would say everybody's just trying to be well and figure out how to do things. It was also the morning that we found out that the local pharmacy was going to be closing. So we fell silent for quite a few minutes and then said, okay, that's going to happen. Let's see how we can, support the community. And Kate, I believe, is doing the best they can at the clinic to help people. I've called a few people here in the West End just to see how it will affect them. And some were quite shocked. And others said, well, that's okay. I get it in the mail anyway. So I think we have a variety of people that are doing various things. And, we'll make it. And look forward to January when the clinic has their pharmacy going. So that's my report.
Thank you, Commissioner Storley. Next, we have North Shore Collaborative, Commissioner Mills.
Yes, we did meet, and I think probably the thing to really report on is that we had a presentation from the Arrowhead Collaborative Leadership Council with prenatal to kindergarten, and I had known it, I guess, more as like the child care collaborative or early childhood, basically, group. And what they were asking of the North Shore Collaborative is to be the fiscal agent to try to really get some grants going for early childhood programs and care. And it's a very exciting opportunity. It's maybe not the best place for it, and so we wrote a letter. We asked to have a letter written and sent supporting the efforts and declining the request to have the group be the fiscal agent, because the North Shore Collaborative has a fiscal agent through Lake County, so it would be a little convoluted if I don't think we could be their fiscal agent, and then we'd have to change bylaws and all that sort of thing. But I did think that it was worthwhile for our board, the Cook County board, to be in touch with them. Their intentions was to be broader than just Cook County, also be Lake County and more in the region, and with the idea that these issues with childcare and just early childhood services aren't just in one county. This is across the whole region. And so I hope that they come and find some fiscal agent for them, but we just decline that. So I think they're trying to keep it less political, not trying to come to an individual county board. But I think that might be the strongest way to go forward. So I hope they do. But just a lot of support in general for it. So we felt a little sheepish for turning down the request.
Dave?
Go ahead, Roger.
Yeah, Dave, I have a question. Were the LOTS programs held this summer throughout the county in Grand Portage?
Yes, and will be again. With that, we had volunteers, and Sarah Silence in Cook County did recorded reading the books for people during the pandemic. And the first one I think didn't go so well, and that was, I mean, it didn't go terribly or anything, but I think that it didn't get too many views, and it maybe was the content, just that one particular book for whatever reason. But the other ones, I guess, went very, very well as far as how many views they got, and so that program is going strong, and we're all the better for it in the pandemic time too. So.
Good to know. Thank you.
All right, next we have emergency preparedness. Myron.
Yes, I was absent. I could not make that meeting, so I know that Dave Mills was there, and I think Rena, so I'll turn it over to you, Dave. Thanks for attending.
Yeah, the attendance was poor. It was just, I think it was just county people, and kind of we're all in that loop, and we were just kind of talking about what was going on. A lot of the talk was about the schools and decisions there, and just trying to plan for that. So it was a short meeting, and yeah, I think it was all just kind of preaching to the choir and keeping everyone in the loop who was already in the loop.
Thank you, Commissioner Mills.
Oh,
so the
I'm sorry, unless Rena, you wanted to add any more particulars or specifics there.
No, I think it was a pretty short meeting. It's a lot of interest in what the school board is doing. And I have to tell you, it's been a rather a lot of grueling meetings and difficult decisions. My sense is it's not over yet, that there's some conversation about the board taking it up one more time this week at our board meeting on Thursday. So I'm not quite sure how that will pan out. At some point, I think we have to go with the decision and stay with it and then work from there. But yeah, there are a lot of different opinions, and there's no right answer. There's only, answers that are based on the best information you have. So we keep slugging our way through.
Thanks, Rena. All right, with that, we have for the good of the order. Does anyone have anything for the good of the order? Bobby, you turned on your microphone.
Yeah, I'd just like to pass on. Last week, we had a young man that overdosed up in Grand Portage and he died. And I think there's so much focus on the COVID right now there, which is an epidemic. And I've been talking to community members, and I think we need to look at the other two epidemics that we have in our county. We have drug abuse and we have mental illness. We need to focus on them. This young man had 6 children he left behind. It was really, it's hard on a community, and we can never lose focus on those people that need help. Outreach, anything we can do. A few months ago, I asked about wilderness outreach, if the people were getting the services that they needed. And, they came back and said that they were, and I don't think they are personally. The people that I see, they're living day by day, hour by hour. And if you're in a program, it is very, very important to have that communication. I think they started a few things in the county now that are in person, but the Zoom stuff just doesn't cut it for people. And, unless you're in their situation, you don't know how they're feeling. You don't know how on edge they are. And I think the county definitely needs to start focusing on, we're so focused. You look in our paper, any packet, it's COVID, COVID, COVID. Let's start focusing on some of the other stuff. you know, the stuff that is actually killing people in the county. And it's been great working with you guys. Keep up the work, and I'm sure we'll be passing each other in several meetings. So thanks a lot.
Bobby, I'm not sure I can say that was for the good of the order. I'm just going to show you it was written down before Bobby started talking. I wanted to take a moment in this for the good of the order to talk about Commissioner DeShaw, to talk about his open and honest discussion during these meetings about addiction and about mental illness. Bobby, you have shared with us your struggles with addiction in your own life. You shared with the Arrowhead Regional Corrections. And as you said, you probably scared them all when you told them that you have intimate experience with the programs. We have learned a lot about Grand Portage. We have learned a lot about your community. We've learned a lot about you. And I think that people really need to take notice. You sit back and you take a lot in and you don't say a lot. And when you do speak up, it's to the heart. It's what's truly going on. And so I'm going to miss you a lot. And I am going to miss your input. So I will continue to reach out to you, and I will continue to ask you what's going on there. And I hope that you continue to work with our public health staff to help your community. I know you have your own resources and your own people out there, but you're right. We all need to pay attention. We all need to work together, and we need to help support your community because your community is part of our community. And so I see nothing but good things moving ahead with you as the new tribal chair starting this week. And I see a little bit of sadness with you leaving us and giving us that perspective that we have missed out on for so many years. So thank you, Commissioner DeShaw, for everything that you bring into this world. Does anyone have anything else? Dave, go ahead.
Yeah, Commissioner DeShaw, I wanted to especially thank you for sharing this sad news. It's extremely important that we're aware of tragedies like that and the impact that our community feels through mental, you know, this. You're right. The focus is on COVID and what that focus does and where it, and what it takes away from. It's all connected, and even before COVID, I felt that mental health in our community and in our country needs more and more attention because I don't see it getting better by not addressing it. And I really appreciate you bringing that forward. Like Commissioner Dukirk said in previous meetings on a regular basis, but especially at this meeting, I wasn't aware of what had happened in Portage. Just that something had, and so thank you for sharing that.
Myron?
Yes, I would really like to thank you for sharing that and all the contributions you've made to this work of this group. And I think we should take a look at this again at some point in time about especially treatment and how we can help work with Grand Portage as well as other areas of the community. So I hope that we could deal with that as a topic in the future at one of these meetings. Just to get an update and reflect a little bit more. And I really appreciate the work of you know, the financial with Lori there and Allison in the department, and they're doing very well. And we know that we're going to be having more limited resources, but we also are going to have greater increases for need. And so that's a real challenge to us and to the department. And I think Commissioner DeShaw's words are something that we get. Every life has value. It has a lot of value. And thanks for bringing that up today, and wish you the best and look forward to working with you in the future, Bobby.
All right. So Bobby, I wore this shirt for you today. Kindness matters. And with that, I will take a motion to adjourn.
So move.
Thank you, Jenny. Can I get a second?
I'll second.
Thank you, Andrea. So everyone, we'll just do an all eyes for adjournment. Aye.
Okay.
Aye.
All right. So for the public watching, we will end this Zoom meeting, and then there will be another Zoom meeting to start committee of the whole, and that will start at 10 a.m. So there's a little bit of break in there and you will not see us for a little bit. So thank you all. Have a great morning.
Thank
Take care,
you.
Bobby.
Thank you.